Hello, my name is Anthony Well. I'm a UK and US trained endothelial consultant and neurologist. With the concerns raised about the risk to both patient and healthcare practitioners of catching an airborne infection, virtual clinics have become part of the usual anonymity in assessing patients for disease. Here I'll give my thoughts on how I would generally conduct a virtual clinic for patients with nasal obstruction. Before I go into specifics, I'd like to give a brief talk about the normal anatomy and physiology of the nose. The nose is bounded towards the sides by the sinuses, as well as the orbital cavity, which contains the eye, the muscles that move the eye, nerves, and blood vessels. The roof is formed by the skull base, which basically is overlaid by the brain, which contains cerebrospinal fluid, which helps to feed and cleanse the brain. The floor is essentially the roof of the mouth, which is basically the hard palate with overlying soft tissue. The back, you have the nasopharynx, part of the throat, which houses the eustachian tube opening, which links up to the middle ear and helps to maintain the pressure within the middle ear and making sure it's the same as the outside pressure. Within the nose, you have turbinates, which help to warm the air. Now, all these have a bearing on the function and symptoms because the nose primarily serves as a conduit whereby air goes from the outside to the lungs. It is warmed and humidified by the line of the nose. The line of the nose also helps via the mucociliary transport mechanism to cleanse the nose by shifting things either outwards, by which you sneeze out eventually, or you have an anterior nasal discharge, or it goes down the back, which you either swallow or cough out, or sometimes less elegantly you spit out. The roof of the nose contains smell particles, and this is responsible for the sense of smell. The smell receptors send these up for the brain to perceive, and this has a modality function on the sense of taste. I alluded to the eustachian tube function. What it does is make sure that the middle ear pressure is the same as the outside. If the eustachian tube is blocked, you can have symptoms due to that. So in all this, with blood vessels and nerves, as well as part of the normal constituents, you can deduce the various functions of the nasal cavity and the potential disease that could happen. Now, in terms of your assessment, primarily it depends on your symptoms and your signs, which you can elicit visually. Now, in terms of the history, a seasonal variation in the symptoms or a diurnal, as moment-to-moment variation in symptoms may well give an impression that it's allergic based, especially if its symptoms are associated with pharyngeal, orbital, or nasal itching. And if you have this occurring frequently, you probably know that there's a seasonal variation, seasonal cause for your symptoms. In addition to that, if the patient has sneezing as part of the symptoms, or in addition to orbital itching, the eyes also tend to water a lot, or if there's an association with certain agents like house dust mite, pollen, and also air conditioning, it may well suggest that the symptoms are allergic in origin. If you have this obstruction that occurs, which seems to be positional or due to other factors, that may well suggest that you have a vasomotor rhinitis, or in some parlance, a non-allergic rhinitis, which may be with or without eosinophilia. If the patient breathes through the mouth, they would tend to have a soreness of the throat, and this may well be something that manifests mainly in the mornings. They will be able to tell that it's got nasal obstruction, but what you need to adduce is whether it's a persistent obstruction, which may well suggest a structural abnormality, or if it's intermittent, which may well suggest something physiological or close to that in terms of allergy and other things as well. The nervous system around the nose may be sensory, and if it's involved in these, not only can you have pain, but you can have numbness, and that may well give you an indication that the symptoms may well be something a bit more sinister, especially in association with this obstruction. If the patient also starts complaining of periorbital frontal headaches, that may well be due to back pressure on the sinuses, and that's something to bear in mind, but there may well be primary symptoms local to those areas. If you have loosening of the teeth, you want to wonder whether the disease is primary from the teeth or if there's a sinister lesion going from the nose into the teeth. Bad breath can occur as also retained secretions within the nose. If you have a patient complain of altered smell, that may well have a bearing on the symptoms. Daytime soreness is something you should ask for, because if they're blocked during the night, they would have that. A salty tasting fluid may well suggest CSF leak, especially if there's a history of trauma or if there's a history of unilateral nasal obstruction. Same applies to epistaxis, especially in young adolescents that have a nosebleed with a wet nasal obstruction. You want to rule out the possibility of an angiofibroma. If they're of South Asian or Chinese descent, you want to be concerned whether they may well have a nasopharyngeal carcinoma, especially if it's associated with cranial nerve abnormalities, which you can examine visually, or you can have symptoms that will suggest that there may well be a weakness of the cranial nerves. In terms of crusting of the nose, if you do see or the patient tells you there's crusting, you want to wonder whether there's an underlying autoimmune disorder, and test appropriately, either with ECG or asking for a biopsy to be taken, especially if the patient complains of dry eyes and dry mouth, as in the Zika syndrome that you have. If you have a patient with a unilateral mucopurulent discharge, then you have to wonder if it's a child, whether there's a foreign body there, or if they've got learning disabilities, it may well be the same thing, but this may well present with tumors as well. So that's something to bear in mind. If they have an associated hearing loss, especially fluctuating, there might be something including the eustachian tube opening, and that's something that you want to look into as well. You may well order a hearing test to see if there's an associated fluctuating hearing loss. In terms of work, builders may well have a work-related rhinitis, but you can actually have woodworkers presenting with nasal obstruction and other symptoms that may well have an adenocarcinoma of the ethmoid, and that's something you need to bear in mind, especially if they have orbital changes. Orbital changes tend to insinuate that there's some extension going into the eye from the nose, and this may well present in terms of patients with periorbital cellulitis or sinusitis. It could also be a sign of a tumor which is eroded from the nasal cavity into the eye. So bear in mind, if you have a patient with nasal obstruction with eye changes, that's something that you need to take a bit more seriously. In terms of evaluating the amount of airflow, you could either see if the misting occurs when you put a metal underneath the nose. If it's a child, you can ask them to put a cotton wool underneath the nose and see if it moves with the misting. You can ask them to sniff to see if there's some degree of alar collapse, which is around here. A cotton test could be done where you can actually ask the patient to lift their nose up, displacing the air of the nose laterally. And if the airflow improves, that would suggest that there's an obstruction on that side or a septal deviation. If the patient flares naturally, or if they're breathing through their mouth, that would suggest there's some degree of nasal obstruction. If there's redness around the nose, or if they do have malar rashes around the eyes, you may well suspect that the patient has a lupus erythematosus. Nasal discharge, the patient may not notice it, so that's something to bear in mind in some of these cases. I've already alluded to eye changes or watery eyes, but if the eye is displaced, that will also suggest that there is some lesion going from the nose, which is obstructed into the eye, and also you want to look out for eye changes. In terms of investigations, they're usually limited to blood tests for allergies, a RAS test. You could request a skin test, but after adequate treatment for rhinitis over about 8 weeks, where you know the patient has been using the steroid sprays that you may have prescribed, then there is justification for requesting for a CT scan, which may highlight things if you do have access to a CT scanning modality. If not, just refer them on to your friendly ENT surgeon, who may well take the rest of the assessment. There are other tests that you may request for, which is guided by what your clinical findings are. Hopefully this should give you an idea of the things that you could do to assess your patients that present with nasal obstruction. I hope you find this video helpful.